On the day of the examination, you'll come to the patient check-in area. You'll be registered, and then you'll move to the preparation room. There an IV will be placed, your history will be obtained, and your medications will be reviewed. After that's completed, you move to the procedure room where the sedation will be administered and the procedure will be performed. That generally requires about 25 minutes. The person then goes to the recovery room and gradually awakens from the sedation. That generally takes about 45 minutes to an hour, and then they move to a discharge area where the gastroenterologist will review the results of the examination and make any recommendations.
The day of the procedure is actually the easy part. You walk in, you do your consent. Usually you'll speak to the anesthesiologist prior to the procedure. You'll get an IV medication for the anesthesia, and then you'll undergo the procedure itself. During the procedure, a camera will be inserted from the rectum into the entire large intestine, and if we see anything during the colonoscopy, we can remove it and we can biopsy it. You will not feel anything during the colonoscopy, you will not wake up, and you will not remember anything. It's not a painful procedure. It generally takes about 3 hours from the time that you walk in to the time that you walk out. You will need somebody else to drive you home because of the sedation. You will not be able to drive yourself home.
After the examination is over, the gastroenterologist will review the results with you. In many cases, a polyp would have been found, and in almost all cases, we can tell by looking at the polyp whether it is benign or cancerous. The final result will come when the pathology results come from the lab, and that generally is 3 to 5 days after the exam has been performed. In many cases, the gastroenterologist may tell you when would be the next appropriate time to have a colonoscopy. If polyps are found more than 2, generally it's 3 years to have your next exam. If just 1 or 2 small polyps are found, it is likely going to be a 5-year interval. And if no polyps are found, and if you have no family history of colon cancer, in almost all cases you can have your exam again in 10 years.